The number of people waiting for NHS treatment in England is now the highest since records began in 2007. That's according to figures out today. Nearly 5.5 million people are on the list. Of those, more than 300,000 have been waiting more than a year, although that's slightly down on previous figures. But research also shows that 5,700 patients in England have now been waiting 2 years or more. Here's our health editor Hugh Pym on what the numbers mean for those still waiting for treatment.
Gail is struggling to walk and needs spinal surgery. She has 2 collapsed discs in her neck. She's been waiting for an operation for nearly a year, and she doesn't know when it might happen.
If I had a date for my surgery, there's a light at the end of the tunnel. With no date, there's no light at the end of the tunnel. It is just a long, dark tunnel of pain medication and sofa sitting, and that's my life.
Surgeons say for Gail and others waiting a long time, there's a risk that things will get worse.
They may not have been urgent, but they become increasingly urgent the longer patients wait. And there is no alternative. These patients need an operation. So we need investment, and we need to keep prioritising these patients so they don't get forgotten.
The total waiting for routine treatment in England in June was 9.6% of the whole population. In Scotland it was 8.2% in March, the latest available figure. In Wales it was 19.2% in May. And in Northern Ireland nearly a quarter of the population was on a waiting list, according to March data. Hospitals are keen to get people to come in for the treatment that they need. They're also focusing on trying to reduce the backlog of those who've been waiting for a while. And then there are people out there who didn't come forward during the pandemic, but who may yet require hospital care. Here at Royal Surrey County Hospital, they're doing more operations than they were before COVID struck, with more NHS funding for equipment and extended operating theatre time, though they acknowledge it's a tough task.
I don't think we will be able to work at this rate forever. We are really trying to tackle a problem that has come out of the pandemic. But I think we are really focused across the whole of the system on trying to make sure that patients don't wait any longer than they have to.
Hello, sir.
Hello.
The hospital works with pharmacists and other local groups to get more patients treated in the community.
Do this up loose, not too tight.
Gurmit is being shown how to check his blood pressure at home. That frees up resources for others who need more urgent care.
I would rather carry on doing this rather than, go to the hospital or start making appointments with your GP every 2 or 3 days.
Reducing demands on the NHS will help ambulance services, some of which report their busiest ever days, including in North Wales. More people are having holidays locally. There can be delays handing over patients at A&E. There's certainly intense pressure across the system. Hugh Pym, BBC News.